Many on the right say public health is the enemy of the people, and there are all these issues right now going on, especially coming out of COVID. There's a lot to discuss in that realm, and I'm excited to dive more into the nature of what is public health and what are some things to consider around that with someone today who I know very well. You're listening to
The New England Take.
New England Take. I'm your host, AJ Kierstead, NewEnglandTake.com. Thanks to BKXL for picking up the show. Saturdays, 8:30 a.m. at NHTalkRadio.com and on broadcast radio over there. And big thank you to theGraniteRock.com for sharing the episode every Saturday. Please be sure to like and subscribe on YouTube. That's the big way I try and get word out here with the show. Excited today to be joined for the first time, though I've known him for a few years now, Dr. Jason Aziz. How are you today?
I'm doing great, AJ. Thanks for having me.
Yeah, totally. So, full disclosure, we're colleagues. We work at the New Hampshire Insurance Department together. That's my day job. But this is outside of directly the realm, although our work obviously impacts public policy and things of that nature. But this is not necessarily about that per se. It's more focused on your time in academia, where to talk about your time, your PhD, but as a professor and adjunct and stuff teaching.
Yeah, so I'm a professor of physical activity, nutrition, and health at Tufts University School of Medicine. And, I heard you say earlier, public health is the enemy. And where I believe that that's how a lot of people perceive it and look at it. That's astonishing to me, because that's supposed to be something that helps people, and it has mightily helped people, but something's gone awry and taken it in a different direction to the point where we vilify something so credible as public health. I want to talk more to you about that.
Yeah, we'll dive into many aspects of that, and like I said in the intro, I think COVID really opened people's eyes to the nature of public health even existing, so it kind of, people don't know what to take from that, but we'll dive into that. But to start with, at the macro level, if you got to say, what is public health? What is public health?
So a lot of times the way I like to think about it is population health.
Yep.
We use this term epidemiology, right? And it's, there's an arcane definition for that. Epi means above, demos is the people, and ology, the science of. Essentially, literally, that means what falls onto the people. More specifically, what types of disease and mortality burdens affect the people. And it's really rather a competition. There's a lot of bad things that happen to human people. We're blessed to wake up every day and feel well and be able to function. But that doesn't hold true for all people every day. In fact, we see every day people dying and losing the gift of life, or having disease and getting disability. So that's the work of the epidemiologist, who then starts to translate that science towards public policy. And that policy really is the permutation that we think of as public health. There's some great examples of public health. Water sanitation. Boston, you may not know, was the first city in the world to have a public sanitation system. That's known as one of the most influential public health advents. The Broad Street Pump in London, England, was where the modern public health advent started. It's where Dr. John Snow discovered that the Broad Street Pump in downtown London was actually the source of the cholera epidemic that for 3 decades killed over 70,000 people. More contemporarily, in Gloucester, Massachusetts, Clarence Birdseye. He was an innovator, he was an inventor, but he also had one of the most remarkable public health advents in our time, and it was the invention of the refrigerated boxcar. Yes, that essentially eradicated foodborne illness as one of the #1 killers of Americans, because now people could get fresh meat almost all the time. That was a public health innovation. Then we have the Salk vaccine and Fleming's invention of penicillin. So now no longer were people dying from a tooth infection. George Washington, Thomas Jefferson, they both died of oral infections. They would have lived their full lives if they would have had penicillin.
And when does it start diving into the realm of government being involved, which I think is the main focus of what I want to dive into? At what point so a lot of those are the market, which I think obviously is one of the big drivers, because it enables innovation in ways that from perspective of technology development, it always has to come from the free market for it to really jump in and have widespread adoption. But sometimes you got to have the government kind of like, hey, make a nudge in order to stop people from like dying in the streets unnecessarily.
Yeah. What I think a lot of folks may not know, government's always been involved in it, and at one level or another. The father of modern epidemiology, Dr. John Snow, I was telling you about him. He was the one who discovered the source of cholera. He was ridiculed for 10 years by the institution, the medical institution, when he knew what the source of the cholera was. But because there was no science of epidemiology, he was discarded. But Dr. John Snow was the Queen Victoria's anesthesiologist. And the Queen reigned supreme, pun intended. She forced the medical institution to listen more closely to Dr. John Snow. And then 10 years later, it was reported in the Record, which was London's form of JAMA, that the source of the cholera epidemic in London, killing 65,000 people in that 10-year period, was the Broad Street pump. Don't drink out of it. But that was an example of how government had its hands in public health from the onset of the science. And even to this day now, with vaccine mandates and lots of other types of government interventions in how institutions, public schools, require students to have vaccinations before they can be enrolled. Those are all different examples of the various levels in which government intervenes to take on the important responsibility of population health.
Now, this discussion basically was initiated because I happened to be seeing on LinkedIn one day an article titled "The Cost of Dismantling Public Health: Cuts to Public Health Raise Costs for Everyone. Learn why prevention, vaccines, and family planning save money and protect New Hampshire communities." This is by Tori Jennison, PhD, RN. She's the Executive Director of New Hampshire Public Health Association. And I read this, and I had this initial, yeah, I get it, but I think you're missing the problem at hand right now, where we're in no matter what, as much as we want to move past COVID, that is the I hate to say it's the 9/11, but it's the 9/11 of the past decade. It is the defining moment that has changed the trajectory of our society, our economy, and tremendously our public health. What happened with Fauci and Trump when they were getting us through the pandemic, and the way things were handled from a government perspective soured people when it comes to the nature of public health. Do you think it was justified that people were soured by what they experienced through that, and should maybe forgive and forget's the wrong phrase, but try and heal and move on?
Yeah, that's a great question. It's a complex question. I mean, history oftentimes has the inability to forget. And,
right.
And I do indeed that, unfortunately for Dr. Fauci, good, bad, or otherwise, the way you think of him, this issue was heavily politicized.
Yes.
And, I recall my students in public health to read the 2020 article in New England Journal of Medicine from Dr. Anthony Fauci, and I'll summarize in his conclusions. He characterized COVID, the novel coronavirus at the time, as akin to a severe seasonal flu. And it was less than 3 months after that our entire nation closed down and entered into this pandemic era. So something obviously changed. I attribute as much of that to government as I do to social media and the popular news media, all essentially colluding, maybe through no one individual or entity's actions, but rather a culmination of all of those forces in fear in the public to have brought us to where we ended up with the quarantine and the social isolation and the pandemic. And I think, to your point, as a result, what was consequential to that was this distrust to public health, and really more specifically vaccines. And we're seeing that now with the current administrators at the federal HHS, that they're quickly changing policies and mightily changing policies to make vaccinations that previously were mandated now voluntary. And regardless of how one thinks about that, there's a lot of discussion in public health and epidemiology, scientific circles that argue against that. But what doesn't hearken in those messages, it was really the poor success that we had in a lot of the public health approaches that we took during the coronavirus. We did a lot of things, including mandate multiple vaccinations, and socially isolate and spend over $1 trillion. And that return on investment was lacking compared to some other comparative nations like Sweden is a good comparative nation to the U.S. They didn't have any of those examples in their public health pathways, and their prevalence and mortality statistics were very similar to the United States. Now, some people might say that hindsight's 2020. I wonder what Dr. Fauci would say about that, because he published in just before we shut the whole country down, saying that this is like a serious seasonal flu, which we know that we've had those, H1N1 as an example. We didn't quarantine, we didn't shut down our whole society.
Yeah, it's this, there's definitely people in public policy positions, especially at the federal level, are just as guilty as any politician, in my opinion. They have an agenda that they're there because they feel like it's the right thing to do, and sometimes I think narcissism might sometimes play into the situation a little bit. I think Fauci, there's been enough documentaries out there on Fauci and the problems with the nature of where he was going in his head with what he was trying to do, but it's really unfortunate that that's something we have to consider, but that's always something you should consider. It's always something you should consider with anyone in a position of authority in government. Like, are they approaching things in the way you want them to accomplish, and do you need to maybe make considerations on your next vote? It doesn't necessarily mean he wants everyone to die, as a lot of the more knee-jerk reactionaries would want to do, but it's a lot more complex than just the science. I mean, that's the meme. The science. We're just following the science when there's so many more aspects to the situation than just saying that alone.
Sure. In reading Dr. Jennison's article, I found it very thoughtful. One thing that I did note about it was, she iteratively mentions the cost utility of public health.
Yeah.
But public health is very broad, diverse, and has many domains, as pointed out in Dr. Jennison's article, going from vaccinations to family and reproductive planning, to work and employment function and abilities and things like that. But even within any one of those categories, take vaccines, the cost benefit is very variable across any continuum of vaccination. So we can't say this and be right about it at all times, that vaccines are cost effective. Across the continuum of vaccines, if we there's no additive function, but imagine if there were, we could say on balance, vaccines are generally worth the money if we wanted to evaluate in an econometric function. But when you group vaccines with family planning, with other types of things that are medically based, not lifestyle based. I mean, lifestyle is one of the most cost-effective public health interventions. Why don't we invest
something that's ignored so much?
It gets ignored
more than anything else.
And so, this argument that across all of the medically focused public health interventions, they're cost-effective. That's a spurious claim to make because of this. There's this heteroscedasticity issue that they vary across the continuum of included therapies. So that I get a little bit uncomfortable with. We want to be secular in our approach to evaluate the cost utility. And when I watch the news and these debates about vaccines good, vaccines bad. I've had many point-counterpoint articles and assignments in my classes, and I would assign one group to the vaxxers and another group would be anti-vaxxers, and they'd have to make arguments. Then they would switch and argue on the other side.
Yeah.
That's not the point. The point is that it's rather glib to try to characterize this whole concept on vaccinations as either pro-vaccination or anti-vaxxer, because you can't be one of those across all of the vaccinations. I mean, we talked earlier about the mercury-based preservative thimerosal in vaccinations, and that's probably really the number one reason why there's this distrust, not only among public health policymakers, but also vaccinations, because there was this idea that prevailed in the 1990s, that thought that thimerosal-based preservatives in vaccinations was a causal factor for autism. And repeatedly and reproducibly, that has been not proven, never substantiated,
Right.
but heavily
Yeah,
studied.
any articles that were published were rescinded.
Yeah, and yet that distrust still persists.
Right.
So the point of that all is I think we need to be very narrow and very succinct with how we communicate what is public health and how might the government invest in some but not
Right.
others.
Yeah, and the one thing that really, like the ultimate thing from this article that I thought was really missing the point was you're not approaching the real issue at hand with the distrust for public health that people have. It's, well, why don't you just, like, it's obvious. You see these solutions. They're right there. If we dump this money at this thing, we're going to magically fix it. When people have have a bad taste in their mouth for just dumping money at the situations. The reason why we ended up with New Hampshire, we got Republican majorities everywhere. You go to the federal level, we got Republican close majorities everywhere. Got the executive branch again after 4 years of a Democrat in place. Dumping money is not something people want to stomach anymore. There's much more complex ways that need to be approached if you want to have any money put towards anything. You have a PR nightmare you got to fix that has been ignored over and over again from either the lobbyists, the policymakers, the activists from the left that have approached this. Ultimately, a lot of this has come from the left. And they're not looking to, there's like no real apology or saying, hey, look, we need to shift because that didn't work. We need to do this instead. Or it's this offhand, oh yeah, we may have done that wrong, but we need to really do this now, as opposed to like a legitimate evaluation and coming forward and saying, hey, we screwed this up a bit. We should have probably approached this differently.
Yeah, I mean, you heard me say earlier, history never forgets.
Yeah.
Conversely, politicians never remember.
Yeah. Oh, yeah.
and you know, in the work I've done here with the legislature and among a lot of politicians, I can't say that I've ever heard reconciliation that way. But the way I think of this is, you're right. The total cost of it needs to be the first thing matter of consideration. And we hear this term precision medicine or precision nutrition, precision, all these things, right? And I think we need to find what types of preventative therapies are the ones that our government should highly encourage. I would not necessarily say mandate, because I'm really not fond of government mandates. We live in the live free or die state. We're
Exactly.
free living Americans. We should be free to make our choices, but the problem is that the financial incentives for us making poor choices that negatively impact our health are not aligned with us making the right choices.
Right.
I'd like to see more of that. Nonetheless, I think we should have a much more precision-based focus on public health versus some of this, you know, we group it all together. And when we start to include things that are very politically and socially charged, like reproductive rights, it starts to get awkward for people to understand. And I think that can be a source of vitriol and fighting, and that never helps to advance public policy.
So we discussed something yesterday that I think is really important we bring up, and that is the nature of what population public health is going to focus on in order to fix a problem. Is it something that should be handled at the macro level where the entire population is going to be affected by the course of action like we saw during COVID, versus a very nuanced, hey, whatever example you want to give out there, AIDS, for example, like it's obviously focused on a very specific population. You don't take necessarily the same population of people that were affected by AIDS against everyone else in the country that's nowhere near possibility of being affected. Those are two very different approaches, but it seems like a majority of maybe it's not appropriate to say a majority, but quite often we're finding people are wanting to take the macro approach to everything public health across the board, which isn't always the appropriate thing to do.
Right, that's quite expensive, both in financial terms or budgetary terms, but it's also expensive in terms of the marginal social cost. You
Right.
can't. We do have enough economic resource to probably eradicate one disease. Say we picked one disease, we took all the financial resource and put it just towards that one disease. We could we could theoretically eradicate it and would never lose any lives or any years of life lost to that. But then that leaves all these other diseases, underfunded or unfunded. And so the public health policymaker is forced to reconcile this conundrum, really, that resources are constrained. That's the fundamental theorem of scarcity in economics, that they're fundamentally constrained. So how much into which endeavor do I invest these constrained resources? And that's where, like, there's two, with regards to, say, a common disease, an infectious disease or a cardiometabolic disease, there's two camps there that you could either reduce the average risk or protect the high risk. An example of reducing the average risk might be something like adding fluorine to the public water system. That reduces the entire public's average risk for dental caries, for tooth decay. Whereas protecting the high risk is something like patients diagnosed with hypertension. We put them on ACE inhibitors or ARBs, and we give them those medications to control their hypertension because they're at high risk for cardiovascular disease. Those are generally two camps of many, but that are salient and germane to this, I think, discussion that we're having. It would have been my hope on the precipitous of, the COVID pandemic, that we really took the vulnerable population, the high risk of mortality for COVID-19, so the elderly, those with respiratory illness, or maybe even compromised immune systems, and isolated them, quarantined them, or maybe mandated vaccinations in them, maybe. Although I don't think that would have been salient in my lens at the time. But instead, we quarantined the entire society, shut everything down, essentially by proxy, picking reduce the average risk. Right. That's very expensive, not just in economic cost, but also social costs. Think of it this way. Students who didn't get to walk down the aisle when they were getting married or graduate or play their last year of football or dance class, or get to see their parents that one last time because you couldn't fly, or get that surgery because hospitals were closed down. There was a myriad of effects which additively cost our society not just $1 trillion in financial and economic costs, but frankly, things in our lives that we'll never get back, experiences, contacts, and things like that. Not to say nothing of the types of conditions and diseases that were modulated or driven by that isolation, like depression, like suicide, like even cardiovascular diseases, because people were just, liquor sales went up that time.
You walk around downtown Concord through the first 2 years after COVID broke out. The handles of booze you'd see everywhere.
So those social costs were ignored by many a public health professor, and I know this because I'm quite disenfranchised on a lot of that. So you talk about distrust, yeah, I hear those words and they echo in my head all the time, and I'm rather disenfranchised with how that system served the American people in that experience. But we should learn from that. Whether or not we have, well, that's a matter of debate.
There's also a lack of trusting individuals to take personal responsibility for what they got to do, and if they're going to be risky in some way, that's on them to kind of deal with the consequences of it to a certain. To talk about from an economic perspective, like you want to encourage people to do the healthy thing because they're going to feel more enfranchised to continue to do the healthy thing, as opposed to say, screw it. The government didn't say I don't have to do it. They've been micromanaging everything else in my life. They didn't say not to do it. Whatever. Consequences be damned.
That's interesting, and I've not heard that viewpoint. It almost suggests to me that some of that stuff we saw in public health and governments was some form of advocacy of how do we handle a health crisis in this country and maybe our personal health. I'd never heard that viewpoint, but it fascinates me.
Populations just tend to you see it over and over again in especially more in governments where they're a lot more hands-on, let's put it that way, with their population, with what they want to do, they tend to just go along with whatever they say, and the more and more that tends to happen, their minds just go, okay, well, it is what it is. It's kind of, in online culture nowadays, is called like the normie behavior. You're your normal person that's not online. They're not necessarily paying attention to the trends, but they're following what's happening on the legacy media day after day. It's the thing I always harp on, is if they're seeing on the news day after day this or that, it's going to have an impact on how they vote, how they approach their day-to-day lives, and things of that nature. And if they're just saying, hey, the only solution to fixing my depression is to take this SSRI I see on the advertise every 5 seconds, they're just kind of, oh, I mean, I see it all the time. I mean, why not? Well, this should be the thing I do, as opposed to there should be a focus on, hey, you got to take care of yourself. You need to exercise, and you move around at least. You need to eat better, as opposed to just relying on drugs and food.
That's a great viewpoint. One which I wasn't sure what direction you might be taking me with
I never know
with
what
that
direction.
prologue. But there's this arcane debate about public health and who should have the control over it or the ownership.
Yeah.
And you just mentioned, government and their mandates, but at the same time, should our healthcare industry have autonomy over public health? Think about how our healthcare industry functions: prescription drugs, obesity medications, vaccinations, versus a lot of governments in other countries, and even the Make America Healthy Again, dare I say it, executive order. I think it was actually, interestingly, and maybe not surprisingly, published on February 14th of 2025, Valentine's Day, right? The heart, think of the heart. But the second paragraph, the first sentence said, obesity medications, physical inactivity, and poor diet. Those three tenets to the three biggest risk two of the three biggest risk factors for the three top morbidity burdens in the U.S. were addressed right there. Regardless of who the person running HHS was at the time of that publication that was a really optimistic signal for me, because that wasn't...
Me too.
It was essentially vilifying obesity medications, but encouraging improvements in physical activity and diet. Yeah. And those are the three domains of epidemiology that I teach at Tufts Medical. Yeah. That's what we need to get people doing. And I saw that as the first signal ever that I've seen in my career in public health, as a government in the United States promoting something that was not medically based for public health. I mean, I truly believe, and always have, it's a tenet of my life, that the human body has just about everything it needs to be strong, healthy, and to heal itself. Yeah. In our modern day medical system in the United States, which I think has a lot of advantages, but it has a lot of liabilities, and that's the work that we do every day, it very heavily points us towards the medication pathway. Yeah. And so this trust issue is a real issue. You bring it up, and it has to be overcome. The question is, are we pointing our suspicions and angers towards government, or should they be pointed towards healthcare systems? That includes pharmaceutical manufacturers and hospital systems, and even some medical providers, like a lot of med spas. Like 60% of GLP-1 prescriptions are coming from med spas. Is that what we want to get our health promotion, our health advice, our health information? Because there is this distrust for government, but I saw a really good signal. And so, but unfortunately, that signal that I saw was tainted and biased by a lot of media messages saying, don't listen to that person, they're idiosyncratic.
Yeah, we can only hope it starts going back in that direction. Because the focus, the focusing on Tylenol, we got to focus on other things than that silliness. All right, we're about out of time right now. Dr. Jason Aziz, professor over at Tufts. He's the health economics director at the New Hampshire Insurance Department. So we'll definitely have you back on, because there's a lot more to discuss with this for sure. Thanks for joining me.
Awesome. Thanks for having me. I love it.